Australia. We are back to normal routine. So yes, I think it's on now. Okay. So back to the rabies, the Indian story. The rabies, so much has been written, studied, and investigated about it. It's very difficult to cover that the whole topic in 1 hour. So I will be touching only the salient features with a focus to what we are lacking or what it will need for us to control the disease in India. So as I've already said that Indians knew about the disease since 5,000 years, since the Vedic times. They know about the disease, that it is spread through dogs. They even knew that it spreads through saliva. However, it's a tragedy that we have not been able to control this disease, and in fact, we sit at the summit of the nations that record the highest human mortality due to this deadly disease. So first, just the preliminary things. Oh, how does this slide move? Okay. Yeah. So rabies, as you all know, is can be defined as an acute encephalitis or meningoencephalitis, and it is caused by the Rhabdoviridae, which belongs to the family Lyssavirus, and there are more than 20 serotypes of Lyssavirus, and Rhabdoviridae or the rabies virus is just one of them. But none of the other 20 variants are as deadly as the rabies virus. Now, the infection of the rabies virus is through bites, and the humans are the dead end host. I mean, technically speaking, humans can spread it, but there has rarely been a direct transmission from human beings to another human beings. However, there is a recorded case in America, Wisconsin, where a person who was bitten by who had rabies, although he didn't know about it, and he perhaps succumbed to rabies, and it was doubted that he had some kind of encephalitis, and his organs were donated to 4 different people, and all 4 of them ended up developing rabies, and they died of rabies. So that's one case where there was a direct transmission from a human being to human being. Otherwise, usually humans are the dead end hosts. It has a variable incubation period. It ranges from 10 days to the recorded case is 12 years. So it depends upon the speed by which the virus reaches the brain, and that is relative of the area where the dog bite has taken place. So you all know how rabies virus spreads. So this is a graphic on that. There is a bite, and then the virus replicates at the site of the bite, and then uh, it travels through retrograde propulsion up to the spinal cord, and from spinal cord, when it reaches the brain, the transmission takes a centripetal action, and by that it spreads to all the other organs very fast. So that was about the incubation. Then ecologically, rabies is found all over the world, but it is found in two different kinds. One is called the sylvatic form. The other one is called the urban form. The sylvatic form is restricted to the jungles, the forest, and the warm-blooded animals out there are affected. The dog variant is the one which is the deadlier one, which is the cause of concern, and it is usually spread through dogs. In India, the main cause of the rabies, human rabies, is caused by dogs, and all the variants of the human rabies that are found in India are the dog transmitted variants. So how can you prevent rabies? We can prevent it by using post or pre-exposure vaccines. We can prevent it by vaccinating the largest reservoir, that are the dogs. We can vaccinate them to immunize them against the virus. And the studies have revealed that it mostly affects the most vulnerable population of the society, the people belong to rural areas who are less educated, who have got less awareness about the disease, or whose means, the material and monetary means are limited. Children up to 14 years of age are found to be most affected for various reasons. Maybe the dogs finds them easier to attack. There have been cases where children are seen to provoke the animals. Most of the children, when they get bitten, they don't report it to their parents so that they can get the PEP in time. So there are various reasons. However, the most incidences of rabies virus, they take place, they affect the children. And as I already said, the most vulnerable group of the society, the people who are belonging to the poor socioeconomic group, they are the most affected group. And talking about burden of rabies, in the world there are about 59,000 deaths, of which 60% is contributed by India. So we have about 20,000 deaths that are happening, but these deaths are grossly underreporting. And the last estimate of 20,000 deaths was done somewhere in 2013, and it was just a extrapolation of the number of deaths that were recorded in various hospitals. So it is estimated that the real number of deaths may be really very, very high, and they are not really reported. The second one is the economic loss. According to a study by Keddy Hampson et al. In 2015, it was reported that in the world, 8.6 billion US dollars were spent in 2014. That was the annual spending, and of which 2.4 billion dollars were spent in India alone towards this disease. That includes programs like ABC, that is birth control and mass vaccination of dogs, and spreading awareness, and the prophylaxis expenditure of PEP for the people who get bitten. The third estimator is called DALY. DALY is disability or death adjusted life years, and in DALYs, rabies was generally not included for DALY's calculation, but it was done by Noble et al., and that's the figure included here. It recorded almost 1/3 of the total DALYs for the disease in the world. So coming to rabies in India, now I'm just narrowing it to how it affects India. So 60% of the annual global mortality due to rabies, it occurs in India. And of this mortality, 35% of the deaths, it takes place in children who are less than 14 years of age. Now, foreign tourists coming to India, 12 tourists out of every 100 who come to India for a visit, they run the risk of being exposed to rabies. Now, 99% of rabies deaths, they are dog mediated. They come from dog bites. And 96% comes from dogs which are free roaming. That means they are not owned or they are semi-owned. Now, India is truly the canine capital of the world with the highest number of dogs, 11.67 million. This is only 2011 census. However, the real estimate, it is considered it is more than 25 million dogs in India. And on the other side, India also has the dubious distinction of having lowest dog ownership rate. Sorry about the spelling there. Lowest dog ownership ratio. That is, out of 1,000 dogs, only 4 dogs are adopted or they have an owner. Now, with so many number of dogs, a person is supposed to be bitten every 2 seconds in India. And of this total number of people being bitten every day, 40% of them, they think that they don't require a treatment for a dog bite. I mean, this is in 2015 and 16. So until that time, we still had 40% of the people who are bitten by dogs, and they still think that they don't need treatment. And the last one, I'm pointing this out because this was one of the reasons that I took up my PhD studying rabies control in India. For even such an organized institute like Indian Army loses about 3 soldiers every year on average due to this disease, due to rabies. So this is truly alarming. So why do we need to eliminate rabies? For those of you who attended the previous webinar, so there was an option for whether we eradicate the disease or we coexist with it. So there are diseases which we can control to a level where they are economically okay for us to sustain with, to live with them rather than to eradicate them. But rabies is such a disease that we need to eliminate. So what are the pressing reasons that we need to eliminate this disease? Number one, that it causes human deaths. And that's the most important reason. We need to eliminate it because it causes death of human beings. Secondly, it affects the most vulnerable populations of our country, the poor people, the people living in slums, people who don't have the wherewithal to or knowledge to go to the hospitals and get PEP, people who are, because of their poor socioeconomic status, are have a larger or a bigger interaction with free roaming dogs. Then thirdly, it will hugely reduce the economic burden on the country. So a huge sum of money goes into supplying the post-exposure prophylaxis, the vaccines, to the PHCs and other hospitals, which are given free of cost to people. But there is a cost being incurred. So that economic burden is huge. And if we eliminate rabies, that burden will be reduced or made negligible. Rabies is also a classic One Health approach disease. And by successfully eliminating the disease, we are going to not only present a very good One Health collaboration model that can be simulated for other diseases, but it will also strengthen our own animal health management systems. So that's why we have to, this is the opportunity that where we eliminate a disease, and with the way we eliminate it, the data that is generated, that can be made use of to fight the other diseases. And finally, in the UN's Sustainable Development Goals, number 1 and 3, that is poverty and inequality, both of these socioeconomic statuses belong to the people who most suffer from rabies. So if we end the disease, we are also serving towards the sustainable goals by the UN. And most importantly, why we need to eliminate rabies? Because we know that it is fully preventable. So many number of people need not die because of rabies, because we can prevent it. So in 2018, the big bodies concerned with health in the world, that is OIE, World Health Organization, and FAO, along with the world body called GARC, Global Alliance for Rabies Control, which is totally committed towards rabies eradication in the world, they united together and they set up a goal to end rabies in the world by 2030, and it is called 0 by 30. And they formed a collaboration called United Against Rabies, and which had mainly 3 objectives. First, to effectively use the vaccines, medicines, tools, and technologies. Then secondly, to have a sustained commitment and availability of resources to achieve the rabies elimination. And finally, to generate, innovate, and measure the impact of these resources which are used to intervene and do the rabies control measures. So how do we measure impact? So these were the three objectives that these organizations collaborated for to achieve as part of the global strategic plan to end rabies in the world by 2030. Now, let's see. Oh, this was supposed to come one by one. I don't know. It's come. Okay. Anyways, so let's see how why in India or anywhere we fail to control rabies. There are four main reasons for that. There is a lack of awareness, and this awareness comes from communities. You know the kind of country India is and the kind of culture we have. So there is a general tolerance for animals amidst us. Hello? Hello? Okay, so there is a general tolerance of animals amidst us. So we like to be with them, we like to feed them. However, this relationship is not complete because we are only partially concerned with either feeding them or providing partial shelter. At the same time, we are not ready, I mean, most of us are not ready to take the responsibility for the vaccination and veterinary care. So that kind of awareness, not only towards rabies, but also towards the largest reservoir, that is dogs, has to be inculcated in Indian population. The second is awareness amongst children because they are the most vulnerable population and they suffer the most. Thirdly, a large part of health staff, especially the frontline medical staff at the PHCs and the rural health centers, they are not aware of the basic requirements of dog bite or animal bite wound management. So their awareness is lacking, grossly lacking. Secondly, we are lacking studies that can give us insight into the population dynamics of the dogs, uh, which can which can uh, uh, which can help us study the impact of interventions. So how impactful, how successful are the intervention strategies? So those studies are lacking in our country. And finally, enumeration. These are one of my favorite areas, and I'll elaborate later as well. Thirdly, in India, there is no incentive for fighting rabies or ending it. What I mean by this is it has been a disease of neglect, and that is also because um, India had limited resources, economic resources, and perhaps other diseases which were causing like infant mortality or women health or various other diseases took precedence over rabies. So rabies was never considered a disease of consequence where money should be put in. Secondly, the burden of rabies was never actually properly studied in India to convince the policymakers, to convince the politicians that this is one disease which requires their attention or which requires resources to fight with. And finally, policy decisions. Part of it comes from not showing them the burden of rabies. And the second, and the very important part of it is the confusion where the ball belongs to, whether it is in the medical code or whether it is in the veterinarian's code. Because here is a disease which affects the human being, but the main cause of the disease comes from dogs. But the dogs even vaguely don't fall into the category of husbandry. So there's always a confusion. So who is going to bell the cat? And this confusion is persisting even now. Whether which department should take lead, where the policy should come from, and that is where the One Health collaboration comes in. And finally, as I said, there is no coordination. So there are many people who are fighting this war, like there are NGOs who are doing a great bit. There are the medical and veterinary fraternity who are doing their bit, and there is government which is also doing their bit. But there is no coordination, and that is why we are not able to have a sustained program, and we're not able to get to a stage where we can study the impact of interventions, take corrective measures, come back and do the interventions more emphatically. Okay, so now rabies control, as we have already discussed before, it can have two dimensions. One is controlling the disease in the humans, and in the humans we have to look after the dog bite wound management, the post-exposure prophylaxis, and increasing the awareness among the communities, the children. And the second one is the control of the disease in canines. Now, the human part, I would say, after the 12th 5-year plan, which started, I think, in 2012, there has been a rapid increase in the awareness of frontline health workers, in general, the availability of PEPs and the RIG, that is rabies immunoglobulins, even in the rural areas. And there has been a shoot up in the awareness level of the people regarding rabies. However, the part that can be contributed by the veterinarians, that is mass vaccination of the largest reservoir, which are the canines, the population management of dogs, and awareness of people regarding the dogs, the responsible ownership of dogs. The and this is like my favorite thing. Not many people agree to it. Putting a value to the services of the dogs, that has not been explored. That has not been spread among the Indian populace, and that is where that is the Achilles heel, where we are actually lacking to control rabies in the country. So as we go ahead, I'll be able to explain it to you more. So when we talk about controlling the disease in the dogs, there are two main ways. Like one is population management, and the second one is mass vaccination. So in the population management, which has been going on in India for about 30 years, like we see many organizations, NGOs, even government hospitals, they doing birth control of dogs. However, the number of dogs have not reduced, and that is because these measures are usually sporadic in space and infrequent in time. So they are not followed one by another. They are not done continuously at one place for a continuous time. Secondly, they incur a high cost. They are very resource intensive. They need trained personnel. They need facilities of a full-fledged veterinary clinic. And the main question, how many of them do the birth control measure for or neuter them? How many you should neuter? And for that, you got to know how many are there. So the very first question, you don't know how many dogs are there. So there are no enumeration methods. Secondly, mass vaccination. It is a cost-effective measure. It is easy to achieve. It is cheaper option. But again, studies tell us that we need 70% immunization cover on the dogs to control this disease, to break the cycle of the rabies virus transmission. But how do we know how many are 70%? I said 25 million, but that again is uh, again is extrapolation of studies done at some places. So if we really go focus and go to focal points, so how many dogs we need to vaccinate in a particular area to say that, okay, so now 70% dogs are immunized and we are going to break the virus cycle. So what are the challenges against control of canine rabies? And now I have shifted the focus mainly to what veterinarians can do. So we have lack of studies on dog bite epidemiology in humans in India. So there are not many studies where we where the veterinarians take up the epidemiology of dog bites, how many people got affected, what section, what sex, and I'll tell you some of the things that came out of my study. Then there are a gross lack of dog enumeration and behavior studies, not only among the researching veterinarians, but also in veterinary schools. So we hardly study how to enumerate these measures, like how to go into study of behavior of dogs, which was touched by Dr. Paturkar as well, that these are the aspects which should be taken up in the veterinary practices. Now, then there are lack of studies in dog bite epidemiology in livestock. I have seen some studies now coming up where the burden of dog bites or the burden of rabies in the livestock have been taken up now. One study comes, I think, from J&K, which was a case of they defined number of bite cases in various livestock, but there are grossly very less studies where the students, the master students or general research are doing this kind of epidemiological studies. Then there is a lack of efficient vaccination and ABC strategy. So I explained about ABC, like we have to know how many we have to neuter to get to that level that the population comes in a controllable state, at a controllable state. There is a study which was done by Sarah Totten in Jaipur, and she says that if we do 80% of neutering in a given area for more than 15 years, and then at that stage we will be able to bring the population down to 50% and maintain it. So it is a long battle, very long battle, and by ABC itself, by only ABC, we will not be able to control the dog population. Oh, we can control it, but it will require a humongous effort. Second is effective vaccination. So, what is the vaccination strategy? Now, vaccination strategy, we have to think about not only parenteral vaccination, but can we do it? Can we augment the number of dogs that we need to vaccinate by introducing oral vaccination? And if oral vaccination can help, are we doing any studies to see how this oral vaccination strategy can be implemented? There are none. So, and finally, we have no studies that are studying the evaluation and monitoring of the impact of the interventions. So, grossly, we have lack of all sorts of data that can help us evidence-based decision making, reducing the cost of interventions and getting better results. Now, just to give you a view of the rabies research in India, 4% of the rabies research in the world is conducted in India. So, of this 4%, 12% of research, 61% of research is lab-based, 27% is clinical research, and the focus of epidemiology, the community-based research is only 12%. And this 12% is basically, most of them are hospital-based case studies or analysis of retrospective hospital data. There are CAP analysis. CAP means knowledge, attitudes, and practices of the communities. Analysis, there are some studies that deal with
Sorry
that.
to interrupt you, sir. Sir, sorry to interrupt you. Your presentation has gone from the Facebook page. Please stop presentation and then again share now. Then it will come on Facebook because it has been gone.
Oh, what should I do? I should.
The share content, click on the share content, stop sharing, and then again share.
Okay. But it says this meeting is being streamed live to Facebook.
Yes, sir.
Yeah.
Yes,
Okay,
now it started. Now it started, sir. You can carry
oh,
on, sir. Yeah.
okay. So the problem was not from my side. It was somewhere lost in transmission, somewhere in the Indian Ocean, maybe. Okay. So where was I? Yes. So yeah. So there are very few community-based epidemiological studies. So by community-based, I mean like by going door to door and taking the questionnaire and getting their reactions. And it has its implications, and I'll explain to you how. So what I did was I took studies that were done between 2011 and 2016, 5 years of studies, and I tried to do a meta-analysis on them, and I found out that I could include only 21 studies, of which this is a regional distribution, south, north, east, west, and east. And these are the duration of studies, which was not very uniform. Like there were studies from 1 month to 1 year, the period for which that studies were taken. There were only 4 studies that came from rural areas, and there were 17 studies which came from urban areas. And as I told you, most of them were hospital-based studies, like 18 of them, and there were only 3 community-based studies. So, uh, and all of you must be aware, if you have read some of the CAP studies or epidemiology of rabies. So usually that they say, or they infer that the male is at a higher risk of getting rabies, because males get bitten more, because they go out for work, or they are more likely to provoke the dogs, whatever. But we found that in my studies, the male to female ratio of the bites ranged from 1.02, which is like almost parity, to 4.87, which is like totally in against males. Like they were 4.8 times, males were 4.8 times more likely to be bitten. So there was a wide variation. So and there were variations in others also. So I would just like to share some of the things which might interest you. So I found out that actually the gender variance of victim is not very significant for rural and urban settings. So what I mean to say, that number of male and female in urban areas and number of male and females in rural areas were not significant between them. However, the number of bites, the risk factor of the male and female from community-based studies were not very significant. So that meant that male and females both are at the same risk of being bitten by a dog in India, whether it is urban or rural. Perhaps the problem is there are less females who are reporting to hospitals, and that is why, and because we have more hospital-based studies, we conclude that the female is less likely to be bitten by dog and male is more likely. So this is one of the things for which we need more studies, more data to get more authentic inferences. Secondly, I had a finding from those studies that rural population is more likely to report a category 1 bite, which is surprising. Like you would suppose that rural population is not much literate and it will not report. But in my study of these 5 years, I found that rural population is more likely to report. So does that mean that rural India is more aware of rabies, or does urban India, the literate people, are are they thinking that scratches and licks and minor wounds are safe and they don't need to go for rabies treatment? Then thirdly, another finding which I found was that urban population has higher odds of exposure to bite from provoked dogs. That is understandable, because in urban areas the home range of dogs is smaller. There is more interaction between human and dogs, and that's why the bite cases are more. So the density of free roaming dogs is higher in urban areas. The conflict is a large scale conflict, and On the other hand, rural localities have open spaces. Secondly, the garbage management is poor in rural areas. Now, this is to be understood, like because garbage management is poor in rural areas, so garbage, the edible litter is strewn all over, and that makes dogs less aggressive. Perhaps, I mean, it is just a speculation. Probably they are less aggressive, and that's why you have less provoked bites in the rural areas. Now, this is a great graphic by Click and Barrett, which actually explains the categorization of dogs, which very aptly applies to India. So it actually scales the categorization of dogs between the level of restriction and level of dependency. So the dogs which have no restriction and they are not dependent on human beings for their shelter and food are called feral dogs. And on the other side of the dogs which are fully restricted and they are fully dependent for their food and restriction are the supervised dogs. So these dogs are usually vaccinated by their owners, but the problem is that most of these dogs are pedigreed dogs. They are bought, they are taken care of by their owners because they are kind of an investment. They put money into it, and the gray area is this area where the village, it is called a community dog or a neighborhood dog or sometimes family dogs. These dogs may even have names, and they will find food everywhere. They can like go and sleep in one house one day, other house other day, but none of the families would take the responsibility to get them vaccinated, to get them dewormed, or to take them to veterinarian. So this is the area. The feral dogs are the dogs which do not have any restrictions. So we still have feral dogs in urban areas which belong to no one. So these are the dogs which are causes of the most of the road accidents and unprovoked bites. So this portion are the dogs which have to be taken care of to control rabies in India. Now, how do we do dog population management? Mass culling, which is out of question. So mass culling is unethical and it is not going to yield any result. It has been proven by studies. And ABC and CNVR, I already mentioned, it is sporadic and infrequent. It is not based on any epidemiological data. That means we don't know how many we have to do neutering in what period of time. Mostly this ABC and CNVR are NGO driven. They have no or minimal government participation, which makes very difficult for NGOs to sustain their projects. And finally, most important, they need trained personnel to carry out it. Then, second way, and the other way how we can control dog population is by reduction of carrying capacity. Now, carrying capacity is the necessities that a dog requires to carry on its life, the food and shelter two being the most important one. So, and most of the food comes from in the form of garbage. So we are in a bad habit. I hope Swachh Bharat Mission has improved it. But still, we are in the habit of laying edible litter outside in the road, on the road and the paths, which help the dogs to sustain themselves, to find food. And that's why if we reduce the carrying capacity, obviously the population might naturally come down. Then finally, most important point is we have to promote responsible ownership or responsible dog adoption by our population. And one thing that comes to my mind, coming from my background of army, having commanded a couple of dog units in hard field areas, in insurgency areas, and also have been lucky to train some, on my own initiative, I've trained some of the free roaming dogs or the local dogs, and I have found them to be equally good or equally bad to the pedigreed dogs, at least for the basic obedience training. So what I mean to say is, if we invest in the research on the behavior of these dogs, they can be trained to some level, or they can be they can be made use of by giving some value to them. And once they have a value, you have a larger population which are eager to adopt them, and that's how you can take them off the roads. I know it's a very big ask, but I think if it starts, I think Uttarakhand government has started using the desi, the Indian breed dogs for their police department. I think other states can also follow suit if veterinarians and veterinarians can come up with again evidences that yes, these dogs are also equally good. One of the problems that our rural areas are facing, I come from eastern UP and I know my villages there. So what the new problem, and I think it must be the same other places also, there is a blue buck problem. So because of the forest dwindling, the blue bucks have come to they come to the fields and they destroy the crops. So perhaps if we train these dogs to guard the crops against these blue bucks, I mean, I'm just giving one example. So probably that can encourage rural population to take care of their dogs more efficiently and more eagerly. Okay, coming to the enumeration, that's very important because we have to know how many free roaming dogs are there for doing the vaccination. And if we come to know how many are there, then are they all accessible for vaccination? So dogs, if they are in groups, they are very aggressive, and the vaccinator always runs the risk of being bitten himself. So inaccessibility of free roaming dogs for vaccination is another big challenge why we can't control dog mediated rabies in India. Now, enumeration of dogs is very easy for domestic dogs. It can be done through public surveys, surveys of veterinary practices, insurance companies, kennel pounds, registration or records of dogs, government surveys, or in many countries, it's done through tags and microchips. However, for a population of free roaming dogs who belong to nobody and belong to everybody, there is how do you know how many dogs are there? One is like a guesstimate. You just ask people like how many can be there, and they just guess it, and you rely upon them. But how reliable your intervention would be? Second is physical count, which is practically impossible. And third is a capture recapture method. Now, capture recapture method is a popular method for wildlife enumeration estimation, and my PhD, a large part of my PhD deals with that. So there are various methods by capture recapture technique that can be used. Unfortunately, not many veterinary universities, as I also already mentioned, that they are moving in this direction to find a bridge between wildlife enumeration and dog enumeration and to initiate more studies into it. These are some of the methods. I will not go detail into it, but you can click and maybe study them separately. So it's very interesting area which can actually help us enumerate the dogs and then formulate our strategies. Now, there are some findings regarding the dog behavior and how the inaccessibility of dogs to the vaccination can be solved. And that was, so as I mentioned, that dogs, when they are in larger sizes, larger group sizes, so they are more aggressive. So I did a study to see if a dog is seen many times, so will it be in a larger group or a smaller group? And I found out that in the rural area, as the dog is seen more, it is usually solitary or it is single. The dogs that are seen less are more likely to be in group of two or more. But in the urban areas, it's opposite. The dogs which have a higher recite probability or which are seen more, they are usually in bigger group sizes. However, the dogs that are seen less, they are usually solitary. So what is the inference? Inference is that in the rural areas, dogs probably have a more interactive relationship with human beings, and that is why they are seen singly. They find their means of subsistence in nearby places. But in urban areas, there is scarcity of food, and there has to be fighting among uh, dogs on the garbage points or wherever, and that's why they tend to live more in groups. I will elaborate this point more how it helps us. So then the group size is also larger near the garbage. So when the garbage is present, the group size is more, which is understandable. For body condition, the good body condition dogs are found more in groups. The fair-bodied are, or the poor-bodied are more found in solitary. Of course, I mean the dogs which are not able to be part of the group are left behind, and that's why they are solitary. In the urban areas, however, I found that the the dogs that were poor conditions, they were more in groups, and the dogs which were good condition or fair condition, they were more likely to be in smaller groups. Again, garbage is same for urban and rural areas. This is the effect of the temperature, humidity, and velocity, wind velocity over the group sizes. As temperature rises, as temperature is less, the group size is less. When it becomes conducive, it increases, and when it is too high, again the group size decreases. But the same was not the case in urban areas, and that is probably because urban areas have large buildings, so they had more shelters. Then again, humidity, that again, when the humidity was very low, the group size was smaller. When the humidity became conducive, it rose, and again, when the humidity rose very high, then the group size dwindled. The urban is not very interesting. It is again mixture of results. Then wind velocity, as the wind velocity increased, the group size increased. This was very surprising because this study was done in Maharashtra and Panchkula. In Maharashtra, I did the study in Baramati and in Panchkula. So this I really could not understand because in Baramati, when the wind velocity was high, it was also very cold. So I thought that might be the reason that they increase in groups. Number of dogs found in a group are more, but it was completely the opposite in the urban areas. So this is with the gender, which is understandable. If there is a female, the group size is more because of various reasons. You know, and the age-wise, the older dogs were found to be singly. Otherwise, the young and the adults, they were found to be more in group, more to be found in groups. Same with the urban areas, male, female, the result was the same. In the age-wise thing, all the dogs were found to be in larger groups. However, and there was hardly any difference between the age groups. So in the urban areas, there is a general tendency of the free-roaming dogs to be in groups. So what does that actually mean? That actually means that in the rural areas where we have more chances of finding dogs solitary, we can do door-to-door parenteral vaccination, which is easier. And in the urban areas, we can do door-to-door, but for a larger part, we have to identify garbage points or other points where we can exercise the option of oral vaccination. However, I'm not recommending oral vaccination as of now. It's still under study, and we have to see that how it can be done. But the last paper that was taken out by WHO on rabies, it says that oral vaccination of free-roaming dogs can be done, but it has to be under watch. So it has to be, someone has to monitor all the time like which dog has taken it and which dog has not taken it. This was my favorite slide. Actually, these arrows come by one, but I don't know, on a web presentation, everything has come together. What I actually meant to say was that the rabies virus is a fragile virus, and it is transmitted by dogs. And I mean, I put everything there. These arrows come one by one. All I wanted to say was that we know everything about rabies, that how it is transmitted, how it can be controlled, what is the reservoir, what we need to do, whether it is responsible ownership of dogs, or whether it is garbage management. We know which are who are the vulnerable population, and we are doing, basically we are also doing all the measures that we can take in one way or the other. But the situation in India looks like this slide. So it is so confusing where the thing is going and what people are doing. It's not very organized. So now I'm afraid I'm not able to give that effect. And when I change the slides, I don't know. Yeah. So I would like to quote Dr. Richard Franca from CDC Atlanta, who says that we fail to control rabies in developing countries because we fail to apply all the tools available to us at the same time, at the same place. So as I said, that we apply some measures at one place, some measures at other place, and we have to do a consolidated, concerted effort at the same place at the same time. Next slide will be really confusing because this was to vanish, and it was, so I'll just skip this slide. I hope I've got something. Hello? Yeah. So OIE has also suggested us, it's called stepwise approach towards rabies eradication, or SARE, where in a country where there is no data on rabies, they first assess the situation, and then they plan strategically what vaccination strategy has to be followed, how much awareness level needs to be pumped in, how the resources will come in, how policies are to be affected, how the political intervention of the political class has to be made interested. And then with all this strategy, we do a control measure, and then we move towards elimination. Once the disease is eliminated, then we have to maintain the freedom of disease from that particular area. So this is the One Health approach, what I have made, and it actually is congruent with the One Health approach that OIE or the UAR, United Against Rabies, actually says, and that is called STOP R. So S is socio-cultural, T is technical, O is organizational, P is political, and R is resources. So I've just broken it up and I've presented it in this slide. So when you talk about social and cultural, so it is about how to make people aware of the disease, aware of responsible dog ownership, and how to react to a dog bite, that the wound should be washed with soap and water, it should not be sutured, it should be left open, immunoglobulins should be applied, where to get a PEP, making PEP available, making people understand that dog bite is not to be taken lightly. Then coming to the technical aspect, where the medical and veterinary people come in to play their roles. So there has to be effective vaccination. People have to be trained, both medical for human vaccination, veterinarians for dog vaccination. The logistics have to be arranged. So if we know, I'll just talk more about the dog vaccination. So if we know that we have to vaccinate 25 million dogs, or 75% of it, say 20 million dogs, how that vaccine would be made available, how the cold chain will be maintained, how it will be transferred from one place to another. what is the technical support we would require, and what is the proof of concept. Like if we say that, okay, in an area we enumerate the dogs and then we go to vaccinate 70% of them, then we have to prove that that model is right. So we have to come back and again do a serological test or maybe genomic sequencing to see that the rabies virus transmission is broken. Then thirdly, the organizational support, where I would say political as well as the educational and ecological, where the One Health approach has to be applied. And when we talk about One Health, all the characteristics of One Health approach, like collaboration, leadership, and bringing in resources, uh, sharing of responsibilities, all those cardinal characteristics have to be understood and applied. Coordination. Then finally, the political is like how to impress the political leaders that this is a disease of consequence. Dog population management is important. Dog population, the stray dog is a wrong thing. Free roaming dogs have to be controlled. Dog pounds have to be made. The place for a dog is in a shelter. It is not on the road. So if it is on the road, then there will be human and dog conflicts, there will be bites, and it is detrimental to the welfare of the dog as well. And then we have to demonstrate by pilot studies, we have to demonstrate to them the impact of what we are trying to say and what we are trying to do. Also, instead of going on a larger political impact, we can start small regional engagement to come to a bigger point. And finally, the resources, which comes from all parts, whether it is manpower research, financial research, logistic research, we have to develop a business model which can take a systems approach to fight the disease in the country level, at the country level. Finally, this is a writing I found up there above Baramulla, which I think is very inspiring, that the mountain is not higher than your confidence, because it will be under your feet once you reach top. So once we defeat rabies, we will feel very, very victorious. So there is no point that the very important thing is, I would like to share a very personal feeling here, that I feel that there is a gross apathy towards rabies. We have just given up. We think that it can't be done. So I think the first thing is to believe that rabies could be controlled. So yes, the mountain can be reached. So thank you very much. That was my presentation. Rabies can't be explained in 1 hour. I had some beautiful slides, but I don't know why. What do you say? The animations didn't run, and the slides came as it is. I have found a company which is called EpiSec, Epidemiology and Sequencing. We are doing few works in Australia. My intention was to come to India to do some epidemiological work, not only on rabies, but also for other animal diseases. But the COVID-19 has thrown a spanner. However, my Josh is not yet down, and I will come back. This is my Facebook Connect, and this is my Twitter handle. This is my phone number. You're welcome to contact me anytime. I'll be happy to help anybody who needs it. Thank you so much for the opportunity. I am open for questions now. Thank you. I can't hear you. I can't hear anybody.
Sir, kindly stop sharing your presentation.
Okay.
Hello?
Sir, the presentation has to be stopped, sir.
Okay. Okay. Presentation has to be stopped.
Yeah. I wish to request our Honorable General Secretary of Indian Society for Veterinary Medicine to say few words about the presentation, sir. Then I will take the questions of audience who have dropped their questions in Dropbox.
Okay, once again, please help me how to stop it, ma'am.
No, not needed, sir. Not needed, sir.
It's downside. It's downside third button.
Yeah.
Downside third button, sir. Share content, not share content.
अरे भाई मुझे तो दिख ही नहीं रहा.
Hello.
हाँ.
So, Indian Society for Veterinary Medicine thanks Colonel Dr. Harish Tiwari for sharing his research findings and experience on rabies in India. He has narrated elaborately about the rabies in Indian scenario and also the global strategic plan to control rabies and also the constraints faced in our country in the control of rabies. So he also pointed out the research that are being conducted in India regard to rabies is very low, and he emphasized the need for more research on rabies and the control of rabies. Sir, we are very thankful for your wonderful lecture on rabies Indian scenario. The participants of our program have benefited from your knowledge and also your experience. Thank you very much, sir. Thank you, sir.
Yes, sir. Tiwari, sir. There are some few questions they have given by our participants. Some of that I am taking.
Okay.
First question is there from Dr. Priya.
Okay.
Sir, is rabid or rabid suspected dog, can we consume the milk of that dog or that animal?
You mean to say rabid cow, right?
Yeah.
Yes. There is so rabies virus is very, very fragile. So the virus is not transmitted in the milk, and even if it is, so if you boil it, it has to die. But yes, it's completely safe to drink the milk. In fact, if you go to the OIE site, the site for UAR, United Against Rabies, the only finding from India that has been shared in their yearly annual report is that the assurance that that a person who has consumed milk from a rabid cow need not take PEP, post-exposure prophylaxis. So that's written out there in the annual report.
There is second question, sir. It is from Dr. Vijendranath.
Yeah.
He has asked, should a person be vaccinated if dog has been bitten to him, is vaccinated? Means dog is vaccinated and that dog is bitten to a person. Can it is needed to vaccinate him also?
Technically, no. So if the dog has been vaccinated and it has adequate immunity, so the rabies is a manifestation when there is a transmission of virus. So if the dog is immunized, he will not have the rabies virus, and if it bites somebody else, the virus cannot be transmitted. Now, however, one has to be very sure that the dog has been vaccinated and vaccinated correctly. There have been cases where vaccinated dogs have bitten people and people have succumbed to rabies. But only reason for that was that the vaccination of dogs was not proper. Either the vaccine that was used was not proper or it was not inoculated properly. So yes, but technically speaking, if an immunized dog bites a person, you don't have to take PEP.
Okay, sir. Now there is really one beautiful question from field point of view. It has been asked by Dr. Karunakar.
Okay.
He is willing to ask, sir, how we can control rabies in animals without supplying of rabies vaccine to veterinary dispensary in rural area. Is it possible?
Please say the question again.
Sir, it is very important as far as the field point of view.
Yeah.
Dr. Karunakar is interested to ask how we can control rabies in animals without supplying of rabies vaccine to veterinary dispensary in rural area. He meant to ask that without vaccination, can we prevent occurrence of or control the rabies in rural area?
If you're talking about rabies in the livestock, I'm answering from the veterinary point of view. That if you want to prevent rabies in the livestock, you have to prevent rabies in the dogs, which are the prime reasons why they would get rabies. And in the dogs, there is no other way than to do mass vaccination. So you have to vaccinate the free roaming dogs that can cause rabies in livestock. So I don't think there is another way where you can prevent rabies. Yes. So you
Yes,
have
sir.
to follow mass vaccination of the dogs, or the dogs have to be controlled and vaccinated by their owners to make sure that the virus is not circulating. Until the point we are not sure that the area or the region is free of rabies virus, we have to follow vaccination. That is the only way to prevent the disease or to control the rabies.
Sir, I am very happy to, it means, share that we are having this Cisco WebEx meeting. At the same time, we are also live on Facebook. I also collected some questions from Facebook audience also, sir.
Okay,
There is
lovely.
a question from Amrit Gogai. He
Okay.
wants to ask, does rabies occurs in birds?
Oh,
Is
does
rabies
rabies?
occurs in birds?
That is a very great question. Yes. Uh, there has not been much evidence, but I remember a report reading last year from India that rabies was found to be seen in chicken. So that's the only thing I know about rabies being in birds. Otherwise, I have not come across any literature which says that rabies was seen in birds.
Again, sir, there is one question from Facebook streaming only by Dr.
Yeah.
Barish. He is
Yes.
asking, all street dogs possess minimum titer of rabies virus or not?
How? What?
Minimum titer. Minimum titer.
Minimum titer for
Yeah, all
dogs.
street dogs. For rabies.
Okay. Yeah, I would not be able to tell you the exact titer, but of course you can get it from literature. But once you do mass vaccination, the titer would vary, and you have to have a titer. I think it is IQ. No, sorry, I would not be able to. I don't want to give a wrong information. But yes, you can check the titer. Like you take a sample size of dogs and you can find out how much is the titer. But sorry, I don't know what exactly is the titer that would render them completely safe. Yeah.
Sir, here in Mumbai Veterinary College also, scientist Dr. Rajesh Farande, he is working on rabies, sir.
Yeah.
He has just inquired, one dose of vaccine in ABC program is sufficient to protect the stray dogs? Is
One
single
dose
dose
after ABC. Okay.
Yeah.
This is an interesting question. Like personally speaking, yeah, one dose is not sufficient because we have to give a booster dose because it will have inherent cross reactions that would reduce the efficacy. That's one point. Second point is because the dog after ABC is already under stress. So how much of titer it can raise, and whether it will be sufficient to keep it immunized so much that the rabies transmission doesn't take place is really doubtful. And third point is that in India, the uh, average age of a free roaming dog has been estimated to be something 2.4, 2 years and 4 months. So there is really no use of vaccinating a dog which is already about 1.5 years or more than 1.5 years, 2 years of age, which is in any way going to die within 6 months. So I don't think it serves any fruitful purpose to vaccinate a dog immediately after ABC. Dogs that are vaccinated as a part of mass vaccination program, I would say that they are any day much more efficient strategy.
Sir, there are again almost 8 to 10 questions. I request all the participants that Dr. Tiwari sir, he has shared his email address also, Twitter handle also. We can, it means, or I will personally collect all these questions and submit to him for its proper, it means answering and other things.
Yeah, I'm not shirking away. Thank you so much for your interest, and I'm happy that I've been I've been able to evoke such interest. But there is a request. Any questions pertaining to the immunological aspects should be directed to immunologists and not to me. But if you have any questions regarding the control strategies, enumeration of dogs, how we can get into the calculation of how much to vaccinate, and that kind of a thing, epidemiological questions, you are welcome. If you ask immunological aspects and other aspects, I will also have to refer to somewhere. I will answer you, but it's better to approach people who are good there, right? Thank you so much for inviting me. Thank you for your time, and I'm very happy to be with you. I'll be happy to receive your emails as well. Thank you.
Thank you. Thank you. Thank you, sir. Thank you very much. Ramprabhu sir, I request you to announce the next webinar, schedule of next webinar, sir.
Okay. Just a minute. Dear friends, so we are having the next webinar series on 11th and 12th of July. The first one is on nanotechnology in veterinary practice, opportunities and challenges by Dr. Vandana Patrawale is a doctor of pharmaceuticals in a pharmaceutical college in Mumbai. And on 12th, the time is 7 to 8 o'clock in the evening. And on 12th, we are having one interesting topic, veterinary medicine and artificial intelligence by Dr. Naresh Kumar Raka. The timing is on 7 to 8 o'clock. So I request all the members to join with us on 11th and 12th evening for study. Thank you very much.
Thank you. With this, I wish to conclude today's both the webinars which has been conducted by Indian Society for Veterinary Medicine on the occasion of World Zoonoses Day. Thank you very much for all the participants, for all the speakers to be a part of this webinar. Thank you very much.
Thank you. Thank you. Jai Hind and good night.
Good night. Good night to everyone.